Good morning and bonjour à toutes et à tous. Today, I would like to share some reflections on the state of public health in Canada as I mark my third year anniversary today as Canada's Chief Public Health Officer. But first, Dr. Njoo has an update on the latest numbers of COVID-19 in Canada.
Thank you, Dr. Tam, and congratulations, félicitations, with your third anniversary. To date, there have been 102,622 cases, including 8,504 deaths. 64% of people have now recovered. Labs across Canada have tested over 2,558,363 people for COVID-19 to date. Over the past week, an average of 38,000 people were tested daily, with 1% testing positive. These numbers change quickly and are updated daily in the evenings on canada.ca/coronavirus. Il y a 102 622 cas confirmés, dont 8 504 décès. 64% des cas sont maintenant rétablis. À ce jour, des laboratoires de partout au Canada ont analysé les tests de dépistage de la COVID-19 de plus de 2 558 363 personnes. Au cours de la dernière semaine, nous avons testé en moyenne 38 000 personnes par chaque jour, dont 1% ont reçu un résultat positif. Ces chiffres changent rapidement et sont mis à jour quotidiennement en soirée sur le site canada.ca/le-coronavirus. Dr. Tam?
Thank you, Dr. Njoo. Over the past months, COVID-19 has tested our public health system like never before. I am heartened by the dedication, compassion, and collaboration that Canadians have shown in addressing this unprecedented challenge. Our collective hard work is paying off. Case counts continue to decline across all age groups in Canada. This progress is encouraging, and it is essential that we maintain our resolve in adhering to public health measures that have helped us flatten the curve. Toutefois, il est tout aussi important de réfléchir aux vulnérabilités que la COVID-19 a exposées dans nos systèmes sociaux et de santé. Au début de mon mandat, j'ai énoncé une vision visant à réduire les inégalités en santé au Canada. Reconnaissant que les problèmes de santé publique sont aggravés par des facteurs sociaux, économiques et culturels allant au-delà du système de santé. It is equally important, however, to reflect on the vulnerabilities COVID-19 has exposed in our social and health systems. At the start of my mandate, I set out a vision to reduce health inequities in Canada, recognizing that public health issues are impacted by social, economic, and cultural factors outside of the health system. Throughout this pandemic, we have seen COVID-19 disproportionately affect those with existing social and health disparities. Critically, our response to the pandemic has revealed failures in how we care for older Canadians. The impact on older adults living in congregate settings has often been severe and tragic. While we have made progress in reducing outbreaks in these settings, it is vital that we accelerate our efforts to better support our elders. Alors que nous apprenons à vivre avec les mesures nécessaires pour freiner l'épidémie de COVID-19, je pense au fardeau que doivent porter de nombreux Canadiens, notamment les aînés isolés à la maison. Les enfants qui relèvent un défi générationnel sont présents. Et tous les Canadiens touchés par l'incertitude sociale et économique. Je pense aussi aux vulnérabilités sociales dont font les personnes victimes de xénophobie, de racisme et de stigmatisation. Ces fardeaux minent notre santé physique et mentale. As we learn to live with the measures needed to control the spread of COVID-19, I reflect on the burdens felt by many Canadians. Seniors isolated at home, children forced to navigate an unprecedented generational challenge, and every Canadian impacted by social and economic uncertainty. I also reflect on the vulnerabilities in our social fabric felt by those who have experienced xenophobia, racism, and stigma, burdens that influence our physical and mental health. In 2019, I reported on stigma as a driver of negative health outcomes and inequities and offered a path for a more inclusive health system. Efforts to eliminate stigma are particularly important as it intersects with other pressing public health issues in Canada. In parallel with the COVID-19 pandemic, many communities across the country continue to struggle with historic rates of drug overdose deaths and substance use-related harms. COVID-19 has exacerbated the impact of the opioid crisis on some populations. Last year, 3,823 Canadians lost their lives to opioids. In May of 2020, British Columbia reported 170 suspected drug overdose deaths, the most in 1 month ever for the province. We know that stigma stops people from reaching out, and using drugs alone is a major risk factor for experiencing a fatal overdose. People who use drugs may be feeling more isolated as a result of the physical distancing measures to control COVID-19. Now, more than ever, we must maintain our resolve to work together to stop overdose-related harms. As Canada's Chief Public Health Officer, my goal is to help create the conditions for every Canadian to achieve optimal health. I call on all Canadians to help me achieve this goal by harnessing the spirit of collaboration to protect and support the health of our neighbours, families, and communities. Thank you. Merci.
Thank you, doctors. We will now open the floor to questions. Vous pouvez poser vos questions dans l'une des deux langues officielles. We ask that you limit yourself to only one question and only one follow-up. We'll start with the room today, Max.
Hi, Max Paris, CBC News. Dr. Tam, yesterday the Prime Minister said that provinces have failed to properly care for Canadian seniors in long-term care. Do you think do you think that the federal public health agency bears some responsibility as well?
Well, I think it's a whole of society issue, and I think that every one of us, every level of the health system should take responsibilities. I think for sure, in terms of the roles and responsibilities, long-term care does fall more in the provincial or domain, but certainly to the private and the public sector as well. But I think, our role has been to support the provinces in the response, also to provide guidance and infection prevention and control. I think, and support the provinces as they increase their testing capacity and their PPE supply, and all of those elements do impact, I think, the health of our seniors and long-term care. So, but I think there are many other federal government departments that have responded by, again, supporting those socio-economic aspects that supports long-term care homes and seniors. Some of them are actually related to supporting those who work there, including personal support workers who may be poorly paid, who have to work in different different homes or different health settings, which also is perhaps plays a role in propagating the virus as well. So it's quite a complex situation, and I think definitely don't forget those essential workers who need the broader social and other supports from all of us as well. So it's definitely not a simple matter, but one where we have to tackle and really at all angles.
Like you said, it is a complex situation, but often the solution when COVID finds itself in a long-term care home is to completely isolate the residents of that of a care home, and that has its own issues as well. Is there? It really seems like a sort of hammer on a nail kind of solution. Are there any more? Is there? I guess what I'm trying to get at is there any way of avoiding isolating seniors so that they can still have interaction with the outside world. Because too often it seems like they basically end up in solitary confinement because of this.
I think there are many sort of lesson learned and reviews that are going on, particularly in the provincial context as well. So I think it would be really important for us to look at that. And of course, the Canadian Armed Forces has also made the observation. So we need to take all of that into account. It is very difficult to experience, I think, physical, but in effect, social isolation. Looking at new ways of connecting someone who is who has to be isolated is very important. I always say that don't discount technology for older persons. It's not that they are incapable of using technology. We need to provide, virtual connections, but also recognizing that it's important for certain supports to come in for feeding and nurturing purposes. I know that when we developed guidance, we specifically looked at essential visitors. And, that helps support and protect the visitors from potentially getting the virus, but allows that kind of interaction and support for those who are in the home as well. I am certain the situations were very difficult to manage, so I can't say what happens in individual, situations. But yeah, I think we all need to look at how we can ensure that we don't have other negative consequences as a result of our public health measures.
Okay, thank you. We have no further questions today, so that concludes today's press conference. Thank you.